You have been counseling international patients since 20 years. I really wanted to know why international patients from Bangladesh, Tanzania, Africa, they are coming to India for their medical treatment.
So Daksh, after counseling these international patients for the past 20 years, what I have realized is that there are two major problems. One is the lack of trust what patients from these countries have on their doctors. Second is that the hospitals in these countries are not as well equipped as we have our hospitals in India. Third, most important thing is that the cost of the treatment. Right now, patients from these countries are traveling to South Africa, US, UK, other parts, Turkey, other parts of the world. When these patients, they fly to India for the same medical treatment, not only do they get better medical care, but also they get to save a lot of money. Fourth reason, which is also very important for patients, is that we have one of the most famous doctors in almost all specialties and super specialties, what might be lacking in their own country.
For example, I am a patient from Bangladesh or either Tanzania or Africa. So what would be the first step I should take as a patient to come to India for medical treatment?
Yes, this is a very good question. And the answer to this is, usually what these patients do is that they apply for visa and they maybe contact some person here and there and they come to India. Now, that is not the right way of going about it at all. What I recommend is that first thing what a patient should do is contact a medical tourism company, get a doctor video consultation done. You should never fly down to India without that. Get a video consultation done. Make sure you are satisfied with the doctor. If you are not satisfied, please ask the medical tourism company to connect you on a video call with a different doctor. Once you are satisfied with the doctor, you ask the medical tourism company for a treatment quote, that how much will your treatment cost, how much is the stay, how much will it be for the food, how much will it be for everything, so that before coming to India, you exactly know how much you have to spend, so that you are not running around here and there. Second most important thing is that if suppose a doctor is sitting in a big hospital in Mumbai, in Bombay, or in India, make sure you ask the medical tourism company to also get a quotation from that particular hospital, so that you now know that what the hospital is going to charge you. So this is very important for patients. Without that, my recommendation is you should not come to India. You should only come to India after you do these two things.
As an international patient, what precautions should I and my family should take before we come to India?
Yes. First thing is that you have to make sure that the medical tourism company which you are in touch with, or the guide who is going to be there, make sure that you have spoken to him very clearly about the terms and conditions. They should come to pick you up, they should transport you to the hotel, they should make sure that they are accompanying you when you go for your consultation. You should also make sure, if suppose you are going to do surgery or any kind of treatment or any kind of surgical procedures you are going to do in a hospital, you should make sure that one representative of this medical tourism company should be there with you for sure. Second is that if suppose you come to India and your treatment is done, but your bill has become more than what was estimated or what was thought of, please express this problem to the medical tourism company. Their representative will speak to the financial counselor of the hospital and try to make sure if they can give some discounts to the patient and reduce their bill.